Assalamualaikum and selamat sejahtera to everyone. Welcome to KMG's Talk, Community Malaysia di Glasgow. It's our first ever speakers event for tonight. I hope everybody is doing all right and safe, whether you're joining from Malaysia, UK, or anywhere else. And I hope you guys have had your dinner. And if not, this is a good time for you to grab your food and drinks and enjoy our talk for today. And so for the title of our event for today is Feminist Health in the UK. And before I'm going to, talk about what we're going to discuss for today in our honorable speaker for today, I'm just going to introduce myself. And so my name is Noreen. I'm a third year biomedical science student, and I'm currently studying at GCU, Glasgow Caledonian University. And so I've been staying in Glasgow City for 3 years, and I'll be the main host for today. And I'm also joined by my two wonderful co-hosts for today, Amrin and Fatin as well. If Amrin want to introduce yourself first, what you're studying, how long have you been here, and if you want to add anything else, just go on.
Okay, thank you for the chance, Nurin. Hello, guys. My name is Amrin. I'm originally from Kelantan. I'm currently here in Glasgow studying computer and electronic system in third year out of 5. And I just came here like in September last year, so I'm still inexperienced compared to anyone who has been here so long. Like Nurin's been for 3 years. Yeah, right. I guess that's all from me. Should we have a nice day today?
Mm-hmm. And so, not sure but before that, we're just going to right into it. And so, just before I'm going to introduce Doctor, I just want to ask, Doctor, how are you been doing? How are you feeling for today?
I feel good. Thanks a lot for the invitation. I'm quite surprised and excited at the same time that I'm being given the opportunity to speak. I think this is your guys' first ever sort of talk of some sort for Community Malaysia Glasgow, which I think is a brilliant organization. And so far, a lot of activities that I have seen, but I haven't been able to join. But yeah, it's a good start, and I'm really honored to be part of this.
Perfect. You're on fire for today. And so just going to talk about the events agenda for today. And so today's talk is going to be divided into two sections. And so the first section, we're just going to talk about doctor's experience and recently moved to Glasgow. And perhaps this is going to be especially helpful to any newcomers coming to Glasgow or who are planning to come to Glasgow. And maybe this is going to help in your decision in, whether you want to continue studying in Scotland. And then we're going in the second section, we're going to talk about doctors working in the NHS in the Greater Glasgow and Clyde. And we're going to talk about doctors' specialization, which is in prostate health, which is what we're doing today, about feminist health. And so just to talk about doctor's background. And so doctor just recently moved to Glasgow last September as well, just like Amrin. And he is currently working in the NHS, Greater Glasgow and Clyde. And doctor is doing a fellowship training in robotic pelvic oncology. Sounds difficult. And doctor's specialization is in prostate cancer surgery and also cancer development. And before this, doctor's work in Malaysia includes being clinical specialist in urology under MARA and also a general surgeon and lecturer at Clinical Training Center UiTM and Hospital Selayang. And so for today's event agenda, at the last section, we're going to do Q&A section. And we have our Vice President Surya here. We're going to take your questions in the comment section. So do drop them below, and our Vice President will take note of them, and we're going to address on it. And so I think let's just jump into it. So, Doctor, before you moved to Glasgow, right? Is Scotland your first Western country that you have visited, or have you been to any other Western country before?
All right. So Yeah, good question. Because I okay, the story started when I was in my undergraduate years. That was, I think, 2002. So literally 20 years ago. I started my medical school training in the Royal College of Surgeons in Ireland. So literally the same date that I flew to Glasgow was the same date that I flew to Dublin for my medical school. That was the same date. So it kind of brought back a lot of memories of the UK, even though it was in the Republic of Ireland. But it was it brought back a lot of memories of being younger, and
Oh,
I'm making myself sound very old. But then it's because at that point 20 years ago we're just fresh out of matriculation, right? So we feel we're young and the world's our oyster, and then you get to go overseas, which is what everybody at that point, all your friends from school wanted to go study overseas, and you got it. So I mean, the most of it, I guess, I would say, I I traveled quite a bit. So Scotland is not first Western country that I've been. So I have been through a few places in for traveling and also for working. For traveling, well, the usual stuff: Paris, France, Italy, Spain. I've been to all that, but and that all sort of culminated to a better world outlook, I guess. You become a very much a world citizen, and you are very much ready to do anything, I guess, anywhere. If you can survive doing things in other countries, give yourself a pat in the back. You're definitely going to make it at wherever you are. So, in terms of the geographic distribution of the places that I've been to, I've worked in Morocco for a year because um, when I graduated, I joined the Malaysian Armed Forces as a doctor, as a medical officer. So I got the rank of captain. And first thing that they did was they sent me, obviously, a single young doctor. Obviously, the first place would be Borneo, Sabah and Sarawak, right? So we do that. I explored Sabah, Sarawak. I was in Cebu. If you all know, it's a 6-hour drive from Kuching. And then, yeah, after that, we went to Morocco. I served for the United Nations. We were part of the medical team that supported the peacekeepers in Morocco. As you know, the area of contention will be Western Sahara, whereby Morocco is trying to Morocco and the local Sahrawi people are fighting to establish locale. So Morocco wants that region of Western Sahara to be theirs, and the Sahrawi people is not, and will want that to be their own nation. So they've been fighting the past, I think, 20 odd years. So they've always been United Nations peacekeepers there. So in terms of travel, and then I've been in the States. I've served and trained in Texas and Florida for military courses around. Yeah, bunch of other places as well. Yeah.
that is a lot.
Yeah, I know.
That is a lot. I see. Wow, because the armed forces, which is I'm quite okay. It's a bit off tangent from today, but quite curious. Was the training? Could you just describe a bit about the training when when
Well,
you were doing?
so obviously, I went to Royal Military College, so that was a secondary school in Malaysia. It's military based. So I guess the military has been embedded in me. Once I finished medical school, I joined the military just because you've been trained, you're used to it, you're familiar with all the equipment and lifestyles of being regimented and all that. So you joined, and masa tu, it's like kalau you join the military for medical officer and beyond, you get to specialize faster. That's what the general consensus is that. And I wanted to be a specialist faster. So I joined the military. But then after that things change, and you plan, life happens, and you change your priorities. So I stopped my service with the military, and then I joined the Universiti Teknologi MARA. So training wise, well, if you're used to it, regimented, people shouting at you, waking up early, making your own bed, shining your shoes, ironing your clothes, making up your bed, definitely the military is something that will be a breeze for you. But it requires a little bit of an open heart, I guess. You just gotta accept it as what it is, and just go with it. But I guess the training is very beneficial for the life in general. The regimented sort of disciplined lifestyle, waking up early, being able to follow a timetable strictly, or in household chores as well, like air baju, kamar katil, benda macam tu, you're used to it, so you'll do it. And that is, I think, my partner, my wife, will probably speak very highly of me in terms of that, because she doesn't need to do it, because I'll do it. So which is I think is the advantage. And for the past 10 years that I've been married, this is something that I've done. So training wise, it's good. It's tough, but I've always believed that if you like it, when you suka, you won't feel it. So that's what it is. Yeah.
I see you, because I was just gonna talk about like your decision of coming from all the way from Malaysia to Glasgow. It's for some people it's a really huge decision. But like, could you talk about how did you get to Glasgow? Like, what was were you applying for jobs, or could you tell me about us about your
Right.
journey? Yeah.
Okay. So essentially, well, when I graduated as general surgical specialist in 2016. So I joined the urology training program. So which is it's another specialty for men's health, prostate cancer, stones, and all that. And the program sort of culminates to a 1 year or more fellowship overseas, because the certification that you get from for finishing that would be from the Royal College of Surgeons and Physicians, Glasgow. So, and that is a UK exam. So also you're pretty much a bit marketable, I guess, or into the international medical scene. And I've always wanted to do a fellowship year outside of Malaysia, just trying to change my perspective, because I'm used to be working in Malaysia as a doctor. So with whatever the environment in Malaysia is, the working environment, I'm pretty much used to it. So this is the opportunity for me to change my perspective, look at how people do things in their own locale, and hopefully if we can bring it back, or if I can improve myself in a way that is making myself much better. And so I guess that's what is motivating me to move and make that trip, sort of to get to the fellowship point. And on the other hand as well, I think it will be a very good experience for anyone who wants to widen their global horizons, especially bringing a family, so that you can experience family life, rather than, if you're being in Malaysia, you have a family life in Malaysia, but it will be some sort of a real adventure to bring your family, uproot yourself from Kuala Lumpur, Malaysia, bring everyone to a new place. So in my case, Glasgow was the place that I was accepted for a robotic fellowship. So the decision is made that everyone will follow, and my family and I, we move as a unit. We never, I don't leave anyone behind. So if I go, everybody goes. We really make an effort, and it was really tough in terms of obviously there are a lot of sacrifices to be made, emotional sacrifices, career sacrifices, and as well as financial sacrifices that needed to be done for us to be on this adventure, which I think so far I have not. There are no regrets. That is the way that I think my family and I operate. We don't do regrets. We just go with the flow, and if it happens, it happens. If it's good, it's good. If it's bad, it's bad. We move on.
When you said, we move as unit, as a family coming, whether you go to another country or not, but that phrase of moving as a unit, to be honest, that kind of hits me because, like, it's really tough to, bring your family here, like where you go, because I know, like, those who have married, but then they do like a single contract where, they had to travel alone to another country, they had to leave their family behind. And so just to bring your whole family here, I could imagine how tough it is. But as you said, it's going to be a really different experience, and hopefully for your children as well and your wife. Oh, just learning a lot already. Yeah, but let's talk about when you arrive in Glasgow, right? And I hope I'm just going to share your experience as well, just after this.
Sure.
When you because you've been to Ireland before, so I'm not sure how. I mean, it was like 20 years ago, but fast forward now, when arrive to Glasgow, you see Scotland. What was your first impression of whether it's the people, time, is it something familiar? Was there anything that like a culture shock to you?
Well, I didn't see it as a culture shock. Tak adalah rasa macam terkejut sangat because you have your home with you, you have your wife, you have your kids with you. So it's not like something that is extremely new. When we arrived, the weather was sort of Genting Highlandish, I guess. Lebih kurang lah. So it's not that bad. And we had a familiar face who sort of orang kita lah, orang Malaysia who came to the airport to pick us up. And subsequently at that point, because we still had to go quarantine and all that, right? I guess I wasn't in shock, but because shock wise, I knew that Malaysians abroad are very, very much helpful because this is the same experience when I went to Ireland as well. Somebody came to pick us up, before we came, dah ada rumah, siap, and then whilst we are settling down, there's food, they ajak pergi rumah, they hantar makanan. I think that's the positive side of our country people when we are abroad, is that we kind of stick together when we need to, but at the same time we don't want to become some sort of a kampung Malaysia punya style. If you know what I mean, we want to, kita tahu bila kita nak bersama, kita tahu bila kita kena berkembang, right? So that's what I see here. We are able to do that, and I hope when I came, that was the expectation, and so far it's quite accurate. We are living up to that expectation as well. So if you ask me if I was shocked, weather-wise, not so much, but I was shocked that we had a lot of sun when I arrived, because I know UK doesn't get a lot of sun, but surprisingly when we arrived in September, it was quite a bit of sun. People were sitting outside and all that, but short-lived, definitely. But then adalah there's some bits of the sun and happiness sort of there. But yeah, I don't know about my wife and kids. Like I said, because we are together, it doesn't feel so much as a shock. Yeah.
I see. Oh, it's true, because like different people have different experiences, and for the sun to be on that day that you arrive, I would say that was your lucky day. It's like Scotland welcome you.
I know. Yeah.
Yeah. Oh, because right, I think because of course, like, because for me, for example, right, Scotland is like my first Western country that I visited, but even because I came as a private student, but I was lucky that I had a senior at the same university that I applied for. So she was the one who helped me a lot. Shout out to Anis if you're going to listen to this later. She was the one who helped me with the procedure of like collecting your BRP or going to the post office and so on, and guided me. But I think like, because not everybody when they arrive to Scotland, they're going to like meet Malaysians, because it's not that, like, for example, it depends where you live, because like sometimes when you go out, there are people who are going to meet Malays, but some people when they go out, they barely see any Malays. So it depends. But how about you, Amrin? When you first arrived here, like, how was
I
your yeah?
yeah, I was never like I never expected to come here like in the UK, especially Scotland. I did have a friend in Scotland before, and he did told me how thick the accent is, and I wasn't really ready for it. And that was one of the main problem. Like in the taxi when I came here, arrived at the airport, and going to my university, I had to like ask for clarification like 5 times before I could understand the accent. Well, that was one. But then as for the weather, I'm personally I'm liking the weather, like the cold weather. Like it was 12, 10 at the moment, and even now it's 6. It's below 10. Sometimes it goes sub-zero, and I really like being in cold environment, so it's fairly fine with me. Yeah, the people are nice as well. And when I came here, I was kind of like the Lone Ranger stuff, because I came here like alone in Glasgow. I had no friends that I know from my college or Malaysia. They all went into England and Ireland, so it was only me at that time. It was hard, but for me, I really like being like in this kind of situation where, because sometimes when you only grow, you can only grow your skills and stuff when you are alone. You have to do something for yourself, like especially when you talk about the West. Sometimes you just get the problem with Islamophobia and stuff like that. And yeah, to be honest, I'm kind of I don't know, expecting them to be Islamophobic sometimes, but well, I guess they're not, and we're good now.
Yeah. So I would like just expand on that last point, because when I first came to Scotland, right, I just like just like you, Amrin, like I had no expectation of how the people are going to be like, and for them to be really friendly in general. Scottish people generally friendly with because I remember when I first came at the immigration, and the police officer was like, "Oh, so it's your first time coming to Glasgow for what for studying?" And he was like, "Oh, so you're gonna up for a drink tonight?" And I'm just like, "No, I'm a Muslim." But yeah,
Yes,
he's just
I'm up for a drink, a coffee maybe.
coffee with me, yeah. But I'm
Yeah.
really glad the people are welcoming and friendly, and so just a little bit of note where especially like for those who are coming here, especially if they're coming as a private student, who are not coming as a batch, where they have no contacts in Glasgow at all, right? I think if you're going out and you're passing by, if you see any Malay, and if they look like they like they want to like talk to you, please do so, because it might be their first time coming to Glasgow. And so plus, I mean, there are a lot of Malaysians in Glasgow. It's just that sometimes it's hard to pass by them. It depends where you live, whether you live in the city or
Yeah. Yeah.
East End.
Maybe
Doctors,
we should have a Raya thing.
yes, it's
Yeah.
what I think. Yeah. And
So
so
I guess the point that we're trying to make is if you are looking to go overseas, kan, social media has a lot of things. For example, for myself, I didn't even know anybody in Glasgow, to be honest with you. So I looked online, I looked on Instagram, I looked on Facebook, anything like Glasgow and Malaysia sort of thing. So I contacted Hakimin on Instagram because he sort of ran some stuff on YouTube as well. I've never met him, by the way. If I get the chance, probably one day, probably have a chat and have some coffee with him as well. So I contacted him on my Instagram. So after that, dimasukkan dalam WhatsApp group, and then from there, I got some personalized information from Shakwan, which is he's been fantastic, through and through. very informative, and yeah, shout out to Shakwan as well for giving us a hand. Shakwan and family for when we arrived, we get second day we got nasi lemak from their family. It's brilliant. It's lovely. Memang terasa ke-Malaysianannya, right? So that's what we do. So for people yang looking towards bringing their family or just moving or just pergi sambung belajar and whatever, don't worry about making the first move to contact. People abroad are very much open to help. I guess it's something that it's our culture, I guess, to help around so much, especially when we are not in large numbers. So we try and tend to help. I don't think we should. I mean, I don't know whether it's a forum that we want to talk about visa and stuff like that. Yeah, macam all the soalan-soalan pasal visa. So I guess a personalized message would be very much better rather than 10 orang bagi opinion. Lebih baik you just get one person who knows it, because procedure will not change. So one guy or one person will just tell you on what to do, and if you have difficulty, you can go on to the next guy, so on and so forth. So regardless of wherever you go, and if you go into to America, to the UK, or even Indonesia, India for medicine, for medical students, you just contact and get a point person, so that you don't get banyak sangat information overload, nanti you tak tahu nak buat apa. So that's a pick-up point that I would like to put forward in terms of uprooting yourself from your comfort zone.
That's true, yes. Because it doesn't just apply to Glasgow or just anywhere, if you're applying abroad, let's say if you're applying to Nottingham or Glasgow, just anywhere, any country, right? There's a very high chance that there's going to be a Malaysian community there. All you have to do is try to find it. So whether it's from Facebook or Instagram, and then for example, let's say if you are like because for example, right, in a city like in Glasgow where we have universities like GCU or University of Clyde, Glasgow University, all these universities have Malaysian societies. And so even though you're postgrad or not, you can contact the societies and they will guide you, and they're very happy to welcome you here and give you all the information, whether it's about documents or settling in, where to find all the stuff, on how to settle in Glasgow. And just I haven't discussed it with President, but I'm sorry. But perhaps in March, we're going to release like an info pack for those newcomers coming to Glasgow. And so there's already a lot of information for you, like to welcome you here. And so if you, don't have like financial constraints or anything, if you like don't need to like overthink whether to come to Glasgow or not, if it's within your like capacity to come here, just go out of your comfort zone, and it's going to be a really huge experience for you to grow as well. Yes,
Yeah.
but before, right? So I mean, it's true that we like doctors like just recently moved to Glasgow, right? Maybe this is a bit too early to ask, but are you going back to Malaysia during Raya or?
Oh, definitely not. I'm working.
Because how long is your training basically?
So it's gonna be a year. It's gonna be a year of training, and then it will depend at the end or nearing the end. There'll be an assessment of competency. If I'm able to operate the robot independently up to a level that is satisfactory, then they will endorse me or sign me off. So I'm able to be a robotic surgeon at a consultant level. So it all depends on a level of competency. If they feel that I won't or I can't, there is a possibility of extending it, but it all depends. I'm not too sure how that works, but usually it's a 1-year fellowship, and you're supposed to be able to do stuff independently before that 1 year ends.
I see. So I think we're just gonna slowly move to like the second section where we're working in the NHS, right?
Yep.
because you're doing like a training at NHS. Could you just like share to us, like maybe what are like the differences that you notice between the NHS hospitals here and the hospitals in Malaysia?
Okay. So basically, I've experienced both NHS and Kementerian Kesihatan Malaysia. But looking at how they run things here on a larger level, on an administrative level, in Malaysia, it is run by Kementerian Kesihatan Malaysia. So Kementerian Kesihatan Malaysia controls the whole country in terms of rollout of planning, facilities, human resources, funding. So it's just like one satu bapak lah, to satu one head, and that's it. Whereas the system in the NHS is that they are the NHS, either England, Scotland, Wales, or Northern Ireland, will receive funding from the government, but then they have NHS Trust. This is based on what I understand. NHS Trust. So each a trust will cover a certain locale. Macam there's for Scotland, there NHS Glasgow GGC, Glasgow Greater Clyde, NHS Lanarkshire, Ayrshire, and then within that, then they get a certain amount of money, and it is up to them to spend it on however they feel should cover their service. So in terms of NHS GGC, from what I can understand and what I can see here, it's pretty much they have a lot, they have many hospitals, and you are expected to move around in the hospital in Glasgow and Greater Clyde. For example, for myself, I operate at the Queen Elizabeth University Hospital, largest hospital, but my clinics are in Gartnavel General Hospital. So it's a different place altogether. And sometimes I go to Victoria Hospital, to the new Victoria for my clinics as well. And then if I'm on call at night, I cover 2 hospitals, 4 hospitals actually. So the Royal Infirmary, Queen Elizabeth, the Golden Jubilee, and then the Vic as well. You cover that, not the Vic, but then those are the 3 hospitals that you cover. So essentially, the from what I experienced in Malaysia, if you are working as a doctor in a hospital, that's where you're going to be. You're going to operate there. You're going to have your clinics there. You're going to have your on call there. Everything is there. But in the NHS, in the system in GGC, you are mobile because they have a trust system, and everything is theirs, and you have to rotate to where the facilities are. From that is what I understand. Operating wise, the robot is in Queen Elizabeth. I can't go anywhere else to do my operations unless it's an emergency. So that's the on a larger level lah. Duit, planning, human resources planning, or facilities planning based on a trust. So you are free to do what the trust and the locale requires. Macam like purchasing of a robot lah. A surgical robot is not a cheap thing. A surgical robot is it's around 10 million pounds for one robot, the latest robot, right? So NHS GGC feels the need that they want to buy a robot, so they buy a robot. NHS Lanarkshire feels that they don't want a robot as yet, so they don't buy a robot. So they are very much independent in that sense. Kalau macam dekat kat Malaysia, KKM kata KKM beli robot. The country will buy a robot. We will put the robot in Kuala Lumpur. So satu negara tu kena hantar dekat Kuala Lumpur. Macam tu for robotic surgery. So dia centralized. Sebab and I feel that in terms of quality wise and access to health, bukan nak kata lah, but Malaysia is much better in terms of access to health. Because if you are sick, let's say 2 a.m. sakit perut, you muntah, there's a GP, 24 hours GP, anytime. You nak pergi, although it's been abused by a lot of people, the emergency department, it's not an emergency, but in Malaysia, the emergency department is always spread into zones, yellow zone, red zone for more urgent and life-threatening stuff. But at the same time, because of they want to cater to the population, they have the green zone, which is sort of an outpatient thing. Taxing on the doctors, tapi for the rakyat, it's much better in that sense. Kat sini, I'm not sure ada the out of hour services tu or NHS 111 tu how how rapidly accessible the health system is. Sometimes from what I heard from my patients yang complain to me in clinic is that even if they call the person on the line to say you can come back next week, things like that lah. So appointment based and stuff, bit more structured, but access is quite limited. I guess both systems have their pros and cons, right and wrong, and that's what is that is the difference between the two. Access is different, quality control is different because of the funding and also the centralization. So in a way, healthcare in the UK is somewhat decentralized because it's based on a trust system. In Malaysia, it's centralized because KKM will control. KKM is the biggest stakeholder. So that's what I feel is the difference, if you get my drift. Yep.
Yeah, those are very solid practical points because, as we, because only those who, work in the NHS, really understand, especially because you've been to Malaysia and then in the NHS as well, where you could see, these main differences. But I just want to talk about, when you're doing the fellowship training in robotic pelvic oncology, right? Because before when you were in Malaysia, you were like a clinical specialist in urology. When you were doing your specialization, was there a specific reason of why you chose urology or robotic pelvic oncology?
I think well, if you ask any doctor why they specialize, obviously it will just come up to it's something that they love doing. So for myself, when I graduated, became a doctor, I've always loved working with my hands. So that's why I picked a surgical specialty. That's why I went into general surgery, and I graduated in 2016 as a general surgeon. But then being a general surgeon has a bit of a lifestyle issue. It's really busy. You operate 24/7. Sometimes you skip. I've had instances where the buka puasa, the nurse datang, swapkan untuk buka puasa because we are doing a big surgery. So in the obviously when you're a bit younger, you feel the rush and you're much interested in that. But then as you grow, you just might want to be more in control of your time. So that's why I picked urology. And that is why urology is my pick, because we get to do surgeries, we operate, we make decisions, we are surgeons, but there is a little bit of a control in sense for lifestyle activities, and the challenges are a bit different as compared to general surgery. And then why robotic is that because I like technology in a sense that I like how the world is evolving towards more automation, machine learning, artificial intelligence, things like that. And I find that in terms of minimally invasive surgery, especially robotic surgery, you see the results instantly. You don't deal with a lot of complications, and you see results like the patient will get better after huge surgery. Previously in the past, what I do in Glasgow is a prostatectomy, which is we remove the prostate gland from the man with the prostate cancer, which we will talk more nanti. After this, we'll have a short talk about prostate cancer. That's the bulk of the work in Glasgow for what I am training to be. So I like the robot gives us a much better view, much better dexterity in terms of operation, and a big operation like a prostatectomy, which previously historically would involve patients being in the hospital for 5 days minimum, is now 1 day experience in the hospital. You come in the morning, you get operated, tomorrow afternoon you go home. So that's how robotic surgery has changed something that is so intrusive into something that is simpler. That's why I wanted to do robotic surgery. I like the way we operate and the results that we get from the robot.
Yes, reducing the number of days needed for the hospital transmission. Really, it helps for the patient as well. The recovery
Yeah,
cost.
it's better recovery. Yeah, economically, walaupun robot ni mahal, but like let's say in Malaysia lah, you buy the robot 14-15 million ringgit, right? But and that orang pandang tu je 14-15 million ringgit, wah, But dia tak kira, will you kurangkan the hospital stay of one person by 4 days, you times that with 1 million people, you probably get back, you save in a way, cost effective, lebih cost effective lah, and that is why I'm hoping that we get to move to that path. We see the bigger picture in terms of cost.
That's true. I think before we're just gonna move on to where we have a couple of slides by Doctor to just introduce just basic idea of about Doctor's work in prostate diseases and cancer. And I think we're going to have our technical expert or President Aiman to just put up the slides for Doctor to present.
Right. Okay. Okay, everybody. Thanks so much for tuning into Community Managed Glasgow's talk. So I guess this is the first time that we're having it, and obviously it's something that is very beneficial, and I think we should be making it into a regular kind of thing and listen for all aspects of life in Glasgow, whether be it health or money saving tactics, places to live, experiences for the children and all that. So that will be a great outlet for people to share, so that a lot of more people either in Glasgow or in Malaysia would open their eyes and to see that Glasgow is an option for work, for study, and people can make it work here as well. So again, I'll say thank you to the organizers, and I've chatted quite a bit with Nurin Amrin, and I didn't get to chat with Azalia just now, but I have shared the journey in a way. If you feel that you would want to ask more, definitely be contactable in any way. I will show how to contact me later. So just a bit of a health kind of thing. So I am a clinical specialist in urology. So I deal with a lot of prostate cancer, kidney stones, and also a lot of male problems. That's what I do. In my working life. In my other life, a brief added on introduction. I am part of a social media community called MedTweetMy. So if you are familiar with that in Malaysia, MedTweetMy is an NGO that debunks health myths. So like previously when we started, there are a lot of people talking about if you take showers at night, you're gonna get pneumonia, things like that. So we've set out on Twitter to debunk all of these things in a scientific manner. So I'm proud to say that after this is our 5th year of inception, we've gotten around, I think, 2.5 million followers on Twitter, and we have a really active Twitter presence and Facebook as well. And if you know, at the moment we are hot on the wheels of supplements. We are fighting supplements, and they are overclaiming things. So if you follow the Twitter chatter from Malaysia, that's basically an NGO that I work with. So we'll go on to prostate cancer. Prostate cancer. Can you move on to the next slide, please? All right. So it's odd that my face is bigger than the slide, but that's all right. Well, okay. All right. So obviously for the lay person, for the non-medical person, when we hear prostate, you know that it is something that your grandfather or your father will talk about, because it is essentially what is a prostate? A prostate is a sex gland. It's only present in men. So it grows because of the hormonal stimulation embryologically, which means when you are growing in your mother's womb, your genetics has determined that you will become a man. Thus, there are a lot of hormonal interplay, and you will get a prostate, and it will become bigger and bigger and bigger as you grow older. Essentially, it's in a normal male, an adult male, the size of a walnut or buah langsat. Okay, so that's what the size is, if you're gonna imagine what the size is. So where is it actually? The prostate sits in front of the rectum. The rectum, if you're aware, the rectum is where all your feces, all your stools are stored before you pass motion. So in front of the rectum, that's where the prostate sits. The prostate is in between the bladder and the urethra, the water pipe. So, and the prostate sort of encircles the urethra, the water pipe. So when you grow older, you will get a larger prostate, and the prostate will compress the water pipe, causing you a lot of urinary problems. You get flow problems, you wake up at night a little bit more. I'll go on to more of that in the next slide. So why do you have a prostate? Why do men have prostates? Obviously, men have prostates because in the activity of when you have sexual intercourse, when you ejaculate, you have semen, which is you need to transport to your partner so that it fertilizes, and you procreate, and you get a child out of it. So the prostate secretes seminal fluid, which helps your semen to travel. Essentially, that is what the prostate is for. It's a very integral part of human beings becoming human beings and making new human beings. Okay, so these are some pictures that probably will give you a little bit more of an idea of what the prostate is and where it is. So the first one on the top left hand of the screen, if you're looking at it, that is a specimen of a prostate when we have removed it from during surgery. So not too much of a big thing. Like I said, it's more of a walnut of a golf ball kind of size. It can grow much bigger when you grow older. As you grow older, so like I said, when we had a meeting about this talk, what I deal with is more of what you will talk to your father to go and get checked. So, and I hope more information will be, you will get more information from the next slide so that you can create that awareness for your parent. So that's the numbers. In terms of numbers, these are interesting things that you can see from prostate cancer. In Malaysia, the number one cancer in men is lung cancer. So number two is prostate cancer. And as you grow older, your risk of getting prostate cancer increases. Not to say that you won't get it when you're young, but in terms of risk, if you're 30 years old, there is a 5% chance you will get prostate cancer. And this chance of getting prostate cancer increases up to 60% when you are 80 years old. So as you grow older, you will have a higher chance of getting prostate cancer. In the UK, these are some numbers from prostate cancer uk.org. 47,000 people are diagnosed with prostate cancer every year. 120 men every day. Every 45 minutes, someone dies from prostate cancer. 1 in 8 men will be diagnosed with prostate cancer. So if you see all these numbers, you're going to be quite amazed at how high the rate of people getting prostate cancer. And this all comes when you have an aging population. This has always been something that we've talked about when we when in Malaysia we deal with a lot of numbers, Malaysia has not yet reached to that level of becoming an aging population, which means that the number of elderly people surpass the younger population. You get that problem in Western countries because, and also in Japan, obviously because of access to healthcare, better healthcare routines, access to better food, better education. So people tend to live longer. So Malaysia, inshallah, soon will get to a level that we are an aging population, and you will see there are a lot of numbers of all these cancers coming up, like prostate cancer, because the older you get, the more higher chance you get prostate cancer. So this is why these numbers are different in Malaysia and in the UK. In the UK, it's more of an aging population. You see a lot of old people walking around doing their thing, so you get a higher incidence of prostate cancer. Next slide, please. Okay, so when you talk about prostate cancer, what puts you at risk? This is something that you can notice, and if possible, make some changes to your lifestyle so that you don't get prostate cancer as you grow older. Number one, you can't run away from it. This having a positive family history, having somebody in your family with prostate cancer, breast cancer, ovarian cancer, puts you at risk of getting prostate cancer yourself. If the family member is younger when diagnosed with prostate cancer, the likelihood of you having a genetic link to it is higher. So if you are interested, we talk a lot about the BRCA genes 1 and 2. If you know about Angelina Jolie and what she has done, because she has that gene, she has a higher risk of breast cancer. So she just sort of like proactively removed her breast to reduce her chance of getting breast cancer. So that gene has been linked to a lot of cancers, and prostate cancer is one of them as well. So that one you can't modify. You can't change your family. You can't pick your family. Number two is something that you can work on. Number two is metabolic syndrome. Metabolic syndrome is actually five medical conditions that all culminate to an increased risk of heart attacks, strokes, and all that. But when we talk about what of these metabolic syndrome components contribute to prostate cancer, would be a waist circumference, which is pinggang yang lebih besar daripada 32 inci, and also tekanan darah tinggi, something that the problem with being Malaysian and being privileged with a lot of nice food back home represents. We get that problem because we have so much good food, and essentially, you know, our waist circumference becomes bigger, and you get a high blood pressure because of the salt that is in those foods. So these two components in the metabolic syndrome will contribute to you getting prostate cancer when you're older. So this is something that you can modify. So if you have a larger waist, maybe, I mean, this is a message to myself as well. Janganlah kita macam doktor ni selalu tunjuk kat orang je, tak pernah tunjuk kat diri sendiri kan. So this is a message to myself as well. This is something that we all should strive for, is that reduce the waist circumference so that you get better. Okay. And then high alcohol intake, smoking, obviously semua cancer dikaitkan dengan smoking. And this is what's interesting when I was doing some reading, is that people who work night shift will have a higher risk of prostate cancer, albeit not big risk, but 2.7% chance of getting prostate cancer. So if you are picking a profession, pick something that is doesn't involve a lot of night shifts, so that your risk will become reduced. All right, next slide, please. All right, so this is something that we get a lot of questions from people will ask, apa yang saya boleh tukar, doktor, in terms of makanan? Apakah nasihat-nasihat pemakanan? So when we talk about dietary changes, there are not a lot of strong evidence to say that this food is linked to prostate cancer. But in general, people have done a lot of observations saying that if you take a lot of fried foods, your risk of prostate cancer will increase. If you take a lot of tomatoes, the lycopene in the tomato is sort of favorable, protects you from getting prostate cancer. Soy products as well will become favorable, ideally because the soy is also a phytoestrogen. So estrogen, punya hormone tu, sort of contrast the testosterone, the man hormone. The testosterone is a major thing that promotes prostate cancer as well, the drive from the hormones. So soy is something favorable, will reduce your risk. And also vitamin D. Vitamin D punya association ni isn't in a U shape punya association. You don't get too little of it, you don't get too much of it. Both of these spectrum ends will increase your risk, especially with us living in the northern hemisphere. We don't get too much sun. This is not a problem back home nearer to the equator. We get a lot of sun. You just go out and you get sun, and then your body will convert it to vitamin D. But the problem here is that you don't get a lot of sun. So vitamin D deficiency, kekurangan vitamin D tu is quite prevalent dekat sini, banyak kes-kesnya. So dicadangkan to get supplementation of vitamin D when you are in the northern hemisphere. And as been shown by some papers during this COVID era as well, vitamin D supplementation and also will prevent you from getting COVID symptoms yang worse. Okay, next slide, please. All right. So when you reach to that age, if your dad or your grandfather has all of these symptoms, you a lot of them when they talk about these symptoms, they also look, kalau kat Malaysia, they talk about it dekat masjid, after solat and all that, they orang sembang antara diorang geng-geng veteran ni, they will talk about, kencing slow lah, malam-malam je kena bangun, malam-malam je kena bangun. Lepas tu bila kencing tu tak habis. So all these symptoms, this is not something that is normal. Don't ever think that this is associated with aging. Alah, biasalah tu, orang dah berumur. No. So this is something that points to a disease. So it points to a prostate punya problem. Sama ada ia cancer or not, which we will need to check further. Okay. So if you get red flag symptoms, macam tiba-tiba kencing ada darah, if you ever hear from your parents or your father, your grandfather kencing ada darah, this is something that needs to be picked up and investigated quite early. Okay. And then kalau dia selalu complain of spine pain, backbone, bone pain, and tanda-tanda prostate cancer yang dah merebak. And also leg swelling. Leg swelling ni berlaku bila when you have lymph glands in your body yang dah bengkak disebabkan oleh cancer, so dia block salur darah tu daripada returnkan darah tu ke jantung. So you get a lot of leg swelling. So these are symptoms. Something that is in the early stages, some is something that points to a more advanced disease. So bila you pergi jumpa doktor, you cakap, if you bring your dad, I always keep and try, because this is a rather young punya crowd, kan? So takkan nak cakap you guys, kan? If you have this problem as well, go to the clinic and we will do the same thing as well. But it's more prevalent in the older population. Nah, you go to the clinic, you see a doctor, you talk about your symptoms to the doctor. This will all point to an examination. Obviously, akan doktor tu kena check, kan, takkan dia nak dengar je, right? So the next thing is that we will do a digital rectal examination. So using your finger, the doctor will use the finger and check the prostate. And because the prostate sits in front of the rectum, so you can feel the curve tu, bonjolan prostate tu. Then from this pemeriksaan, we will see whether there are any nodules, ketulan-ketulan or sakit yang mana boleh menunjukkan kepada masalah prostate. So when I was searching for cartoons to put on this slide, I came across a lot of inappropriate cartoons. So I guess, I don't know, if you want to have a look, you just Google digital rectal examination, cartoon, buka images tu, and you'll see a lot of things that might be enjoyable in your free time. Next slide, please. So after you've been examined, you dah jumpa doktor, obviously doktor tu we will do blood test. So one blood test yang specific for the prostate that we always try and get people to do is the PSA. PSA stands for prostate specific antigen. So this is sejenis blood test yang dibuat untuk mengesan kanser prostate. You don't get orang perempuan to get a PSA because it only is available in the body of a man who has a prostate. Sepatutnya. Okay. Bila prostate tu semakin besar, lebih banyak PSA itu dalam darah, and bila prostate tu ada kanser, semakin banyak lagi PSA itu dalam darah. But sometimes bila level dia tu tak tinggi sangat, kurang daripada 10, it still can mean that it's bukan cancer. Itu something yang we need to bear in mind because a lot of people are psychologically affected bila PSA dia ambil darah. So if you notice there's a trend, which is a good trend nowadays, people going for executive health checkup. Tak kisahlah di Malaysia ataupun di sini, more people are going for health checkup. Just a random, check berat tinggi, ambil darah, check fungsi buah pinggang and all that. And most times, the package will include a PSA. So the PSA ni kalau dia tinggi in an older person might mean something sinister lah. Tapi kalau younger person might not mean anything sinister. So sebab tu selalunya kalau kita kata if we want to do PSA, we will want to do it in people who are more than 50. If they don't have a family history of prostate cancer, or more than 45 years old if they are the prostate cancer in the family. So next slide please. Alright, so when you talk about cancer, obviously cancer, kita akan fikir cancer akan merebak. Tu sifat cancer. Cancer will spread kalau tidak dirawat secepatnya. So kalau prostate cancer ni tidak dirawat dengan secepatnya, ia akan merebak. It will spread definitely. The first place that it will spread is the lymph node, kelenjar limfa or the glands. Dekat dalam badan kita ada banyak. For example, if you are unaware of a lymph node, you selalu boleh pegang dekat bawah you punya rahang ni kan. Kalau if you have batuk, sesama, sakit tekak, you can feel kelenjar-kelenjar ni dekat bawah you punya rahang tu. That is tempat-tempat yang di mana kita ada lymph gland. A bigger lymph gland will be your tonsils. Tonsils akan bengkak, so you akan sakit tekak and all that because you have an infection. So itu contoh of a lymph gland. So untuk prostate cancer, dia akan pergi ke lymph glands, bukan ada terus pergi ke tonsil, tapi dia akan pergi ke lymph glands yang dekat dalam kita punya abdominal cavity, iaitu kita punya perut, bahagian perut tu. Bila dia lagi banyak dia merebak, dia seterusnya akan pergi ke tulang sebab dia merebak melalui darah. So mana-mana tempat yang mendapat darah daripada yang lalu daripada prostate, kanser tu akan melekat ke situ. So dan paling prevalent sekali, paling banyak sekali berlaku ialah merebak ke tulang. Dan seterusnya bila lagi advance, dia akan pergi ke tempat-tempat lain lah. Hati, pergi ke paru-paru, pergi kelenjar limpa di bahagian tengkuk, benda-benda macam tu. So that's how it spread. So if you want to remember, cancer spread. Itu sifat dia. Dia akan spread. Next slide please. Alright, so once you have PSA, you dah jumpa doktor, dah buat cek bontot belakang tu, dah cek prostate, menunjukkan macam ada kemungkinan untuk ni cancer, kita akan buat biopsi. Kita akan masukkan jenis ultrasound ke dalam dubur untuk into the anus untuk kita kesan prostate tu dan put a needle to get samples and send to the lab, and the lab will tell us whether this is cancer or not. Next slide. So katalah you get a diagnosis or somebody you know or your family member get a diagnosis of prostate cancer. So mesti dia akan tanya atau terfikir apakah what are the options of treatment. So in terms of prostate cancer yang belum merebak, the options of treatment are number one, radiotherapy, which is something that I'm not well versed in. Might be something that is best dealt by the oncologist. So ni radiotherapy, and then the next slide will show the next option, which is something that I do on a daily basis here in Glasgow, a prostatectomy. What prostatectomy? Kalau dalam medical terms kan, apa-apa yang ada ectomy ni means removal. kita buang dia daripada badan kita. So appendectomy, buang appendix. Prostatectomy, buang prostate. Mastectomy, buang payudara. So apa-apa yang ada ectomy ni means buang, keluarkan daripada badan. Alright, so gambar ni menunjukkan robotic assisted prostatectomy, which is what I am training to be I'm training to do independently here in Glasgow. So if you want to know more about the surgery, it's not something that is totally done by a robot. It's not autonomous. It's not like kita just program robot tu yang buat, tak. It is something that kita kawal pergerakan tangan robot tu di dalam badan manusia tu, kita kawal melalui konsol. Macam main video game lah, you pegang controller tu and then the character will do. So that's what exactly what happens in a robotic prostatectomy. So ni lah setup Dewan Bedah tu. Akan ada there's a nurse, there's assistant, and the surgeon will usually sit the console kat dalam tu. Kalau tengok gambar tu on the left, yang tengah tengok dalam screen tu, that's the console. That's where the pakar will sit and do the operation. I'll go on next one. Okay, so this is the equipment. This is the surgical robot on your left hand. You can see kalau closer look, ia ada 4 tangan. So we panggil 4 robotic arms. And these arms are well articulated. Maknanya dia punya pergerakan tu you boleh gerak banyak-banyak arah. Berbanding kalau you pakai laparoscopic, dia ada satu atas bawah saja. Kalau robot dia ada semua kiri kanan atas bawah semua boleh gerak. Alright, so that's the robot. Kita akan masukkan tangan, kita akan connectkan tangan ni kepada peralatan yang akan dimasukkan ke dalam badan untuk buat pembedahan. And then on your right hand side is the console. This is where the surgeon will sit. Kepala dia akan masuk dalam tempat tu Da Vinci tu, and dia akan nampak a better view of what's inside and what operation tu. Next slide please. So essentially this is the view of inside when we do prostatectomy. So as you can see, tangan tu macam literally macam tangan lah. So nampak macam big tu is exactly your fingers. Your fingers dia pegang macam ni, and you buka, tutup, dia akan ikut, and then we will do it macam kita godek-godek lah dalam tu. Kita akan, that's exactly the explanation when I try to explain what robotic surgery is. Your tangan, you godek-godek dalam tu, you buka ke, you kucing, robot tu akan ikut. And that's what controlling the robot means. Next. So basically A to Z for prostate cancer in terms of for the lay person yang bukan medically inclined. Semoga information ni kita boleh war-warkan kepada ahli keluarga kita yang lain supaya kita pun lebih aware of what it is all about and options yang ada untuk rawatan. Masalah dengan orang Malaysia ialah kita selalu tak sedar akan rawatan yang ada tu, options yang ada. Dalam sekali pergi berubat. And then, as I said, cancer spreads. And once it has spread, there's not a lot of things that we can do to cure you. So kita nak aim for cure. That's why surgery, radiotherapy is done. So thank you very much for your time to listen to me talking about prostate cancer. Obviously, it's not something for the younger population, but any knowledge is good knowledge. That's what I always say to my kids. These are ways for you to contact me if you have any questions, or if you just want to have a chat about coming to the UK, getting medically trained, random stuff pun tak apa, merepek pun, no problem. That is how you contact me. Alright, so shall I give it back to the moderators then? Thank you very much, guys.
Thank you so much, Doctor. That was a really, elaborative, about prostate cancer. And of course, although prostate cancer affects, like the older population, but there is one of the reasons why, I named this event like Family's Health. It's because not only the older men or even just men, getting educated about prostate cancer, but also the woman, so that, whether you're taking care of your dad, your grandpa, or your family, it's important for everybody, to be educated and be aware of this. And just, to recall, if you know about the symptoms of prostate cancer, if you notice, in your grandpa or like in your older men population, which is poor flow of urine, urination during at night, blood in urine, back pain, bone pain, and swelling of leg. So thank you so much, Doctor. And then we're just going to move to Q&A section. We have a lot in the YouTube comments, people asking different type of questions, and I'm going to pass to our lovely Kak Azelia for you to read them for Doctor to answer.
All right. Okay. Hi, everyone. So we're moving on to the Q&A session. So during this Q&A session, if you do have any questions which is health related, or if you even have any questions that related to like how we're living here in Glasgow, so just drop your comments in the comment section. Then we'll try to read them one by one. So the first one is for Doctor. So the question is by Aziad. So he's asking if I'm coming to the UK this September, so how can I get the booster there? I think it's related to vaccination. Do you have
Alright,
any
so
idea?
yeah, it's the same as the situation is similar to what I faced because I got my first 2 doses in Malaysia. And then when I came here, it was due for a booster. But I can tell it's pretty much quite simple actually. The NHS Inform punya website tu, once you're in the UK, then you need to go to the website NHS Inform tu, and then just follow the step-by-step registration and all that. And then they will set you up with an appointment. And in the first instance, you will need to call them to tell them that you've had your dose 1, dose 2 in Malaysia, and you are registering for a booster. And they will need to create on the back end. They will need to create a username for you and to schedule you. You will get all of this via email, and you just show up, and then they will get your booster. But the problem for certificate purposes, it will not show your first 2 yang kat Malaysia tu. They will not show. In your vaccine certificate yang NHS punya akan kata dose 1. So when you want to travel or you want to show evidence of vaccination, you're gonna have to show your Malaysian vaccination, dose 1, 2 MySejahtera tu, and your NHS punya vaccination. Dia akan tulis dose 1. Tapi tarikh tu, it will be 6 months apart. So the person looking, and you will explain to the authority saying that this is a booster. That's why they call it dose 1, because it's 6 months from dose 1 to 2, which is in Malaysia. Itu je from what I understand and what I'm having at the moment lah. My wife and I, kita orang had our 1-2 doses in Malaysia. Our booster was done here. So that is how I have pictures of my Sejahtera punya vaccine certificate and also the NHS punya booster. In the future, if the world considering for a 4th shot, I guess it will be the same procedure as well. Right. It's quite straightforward and simple. And they are very sort of helpful when it comes to registering you and all that.
But do they need to actually register for your GP first?
No, you don't need to, because you don't need to. This is what I had as well. I was trying to get to a GP, and GP was I was emailing the GP to dia yang tu, lepas tu GP tu hantar balik email tu, we don't deal with COVID vaccination. COVID vaccination direct with NHS Inform. So whoever deal with COVID vaccinations with NHS Inform, you don't need to be registered with a GP. And then because some people, dia orang punya visa macam bukan student or healthcare or skill worker visa, they get a academic tourist visa yang menyebabkan dia orang not eligible for NHS, or dia orang kena bayar for NHS. So these people are eligible for vaccines as well. So that's why you deal with NHS Inform. And then it's a registration. I'm sure if I'm wrong in any sense, there are many Malaysian doctors who have worked here longer and are in the right specialty. The Dr Nazar, he's a family health practitioner. So we can, kalau you have a question, he can also help you as well in terms of family health and how the community health works.
Okay, all right. Now, next question. It's anonymous basically. It's asking kalau tukar tempat tinggal, macam mana dengan GP?
I'm not sure, to be honest with you.
Uh-huh.
From what I read dekat website tu, if you change address, you can find a GP that is closest to your address on the NHS court website, and you can contact that GP directly with an email to register, and they will re-register you to that practice. From what I understand, from what I read. Yep.
Yeah, because I personally I don't have that experience, but I do have a friend who actually moved to another place. So what they do is basically to contact, yeah, like what you said, to contact the nearest GP to the new place, and then you just register. So automatically it would be re-registered to the new place. So yeah.
Yes.
Okay. Next one is by Nusaiba. It says, Assalamualaikum, doctor. It says, let's say if someone is under doctor's follow-up in Malaysia, so where should the referral letter be sent to once the person arrives in Glasgow? Is it the GP? Do you have
Okay.
any idea?
So once you're in Glasgow, you register for a GP. The GP will send an email saying that, yes, you've registered with their practice. First thing, if you want to continue your medical care for whatever problem is, the GP will have to initiate the referral. You can't just go to a cardiologist clinic. Memang tak ada orang akan layan you. Even if you go to the emergency department without consulting your GP first during office hours, tak siapa akan layan you juga. So the GP is an integral person here, as opposed to Malaysia. You can just bypass that. Kat Malaysia, you terus pergi pediatrician kalau anak you sakit. Sini jangan harap. You have to go through your GP. So if you have any medical condition that requires follow up, the GP is the person to go and see first, and then the GP will assist you on whether what you need. You need to go see if you need a referral, if you need medication is continued. That is the GP. Same for personally, from what we're having in our family as well. Some things that needs follow up, the GP is aware, and medicine just continue lah. Dia kata, it doesn't need a referral. He can manage it, so he just continued the medication. So that's my experience.
Okay. All right, great. Now, next one, another anonymous question. If we're taking medication and we're under investigation, which means we need to continue the medication, do we have to pay for it, or it will be covered by the insurance, the IHS insurance?
I don't know what IHS insurance is.
I think it's the one, is it the same as the NHS insurance?
Yeah, it's the one that
NHS, okay.
if you are from if you're like a sponsored student, you have to like pay the one that around 10K Malaysia, something like that, for your whole span of studying here. So it is actually the IHS, which is the insurance stuff. But when I've looked at the IHS website, they did say about you get a free consultation and free treatment just a little bit. But if you're going for surgeries, if you are taking medication, a prescription from doctor, you will have to pay for that. And again, I think it's just the same as in Malaysia, where international people will have to pay a little bit more compared to the locals, something like that.
Right.
Okay, all right.
Yeah, I don't know. I think for families yang depends on the visa that you get, I guess. Because my visa, I work with the NHS, so my NHS is covered. My family is covered by the NHS. Other skilled workers yang kena bayar NHS surcharge. So that means it's a bit more, you kena bayar, but at the end you get NHS punya coverage lah. It's quite comprehensive for NHS.
Okay. All right. Next question. Okay, he says here that soalan is out of topic a little bit, but if we're doing TTC, can we do it in the UK melalui GP?
Yeah. Okay, so I know what TTC means. It's trying to conceive, you're trying to get a baby. So can we do it in the UK melalui GP? Yes, definitely. If you have whatever that has been in Malaysia documentation, I mean, from what I understand, is you get to the GP. The GP will determine whether you will refer you to the infertility services, which yeah, basically that's what our experience here lah. The GP yang macam gatekeeper lah, dia akan direct us. But I'm sure other Malaysian GPs working in Glasgow will have a better idea. So get in touch with the Community Malaysia ni punya admin, and probably they can get they can point you the right direction.
And is this will be covered by the insurance as well, or?
I'm not too sure. I don't know about infertility. Kat Malaysia, it is KKM ada cover, but then you still have to pay some base of it, macam hormonal treatment and all that. But I'm not sure here macam mana. Yeah.
Okay. All right. I think those are all the questions that we had, basically. So, moderators, do you have any questions for Doctor? Or do you have like anything that you want to share with the audience?
If you look, like there's another comment like saying about the food, like how do you find
my God,
food? Like, is it easy to find halal sources? For me personally, like here in Glasgow in the city center, it's quite easy actually to find halal food. Like even the KFC is halal. Yeah, you have to find the right one though. As for the like raw materials like chicken and stuff like that, they have like this one website, I forgot what it's called, halal things, where you can order them online, or you can just find one halal superstore here somewhere. It's quite it's pretty just around the city center, so it shouldn't take long for you to find them.
Yeah, that's actually a lot though.
Yes.
There's a lot of halal butchers, and if you're living near to Tesco, any Tesco, they actually do supply halal meat, halal chicken, halal sausages, and the brand is Shazan. And most of the restaurants, not most, I would say like some of the restaurants are also halal certified. And some, if they don't put up the halal certification on their board or anything, you can actually personally ask the restaurant if they do serve halal meat, halal chicken, and they would just But I think like it's the food here is like super, because we can easily find halal food anywhere. So the sushi is halal as well. There's a lot of food which is halal here, which is amazing compared to like, because they said like back in Edinburgh, there's not much of halal food compared to here in Glasgow. So they're kind of like jealous of us here in Glasgow. I don't think there's any more questions, right?
I don't.
Oh, yeah.
He's a doctor here, I think.
Prescribed medicines in Scotland will be free if you have paid for IHS as part of visa, not free in England. Oh.
Yes,
So
that's
come to Scotland. Come here. Scotland
right, come to Scotland. That's great.
The more reason for you to study in Scotland, or
free medication.
Yeah.
Yes, because just recently, like visiting the GP as well, and I was given my prescriptions, and then the doctor, we had to take, like for me, I have to take my prescriptions from my nearby booths, and they just give me the prescriptions, and I didn't have to pay for it. So I was like, oh, like this is free, but technically it's not free. I mean, because you have paid the IHS, so which is why you don't have to pay again.
Right.
I think actually there was one question that I saw. It was really at the very beginning. It was about, let me just read that question. From Anonymous as well. So this person just said, it's kind of scary to go overseas alone. So doctor, do you have like motivation for this person to go out of their comfort zone and study here or working here?
Well, okay, so getting out of your comfort zone is an absolutely fantastic journey. So memang it's scary, and no one has ever said that it's not. It's obviously scary, but it is something that is made easier with a lot of good people around you. In its essence, you must realize that you are never alone. there will be somebody who has gone through it or will be going through this experience together with you in their own way. So kalau macam you're traveling to Glasgow, let's say, these these talks will benefit you. A lot of people will be contactable, and even if the act of traveling itself is already something that is scary, you best be, you must realize that there is another person being scared as well on the same flight as you are. So when you think of it, then you know that you are not alone. It makes it less scary. So just go for it. Go with the flow. It will turn out good in any way, in any whether in any outcome. It will be something positive can be gained from it. So that's what I must say. Kalau you rasa takut, you must know that somebody else is as takut as you are, but they orang boleh buat. Kenapa? If they can do it, you can do it as well.
Precisely. How about Amrin and Noreen? As undergrad, how do you feel coming here for the first time alone?
Well, I kind of enjoy my time alone, so I'm like the adventure type of guy where just find new stuff at new place with no one knowing you. You just have the freedom. Yeah.
I would say I'm the opposite. But I think it's just the beginning part, because as I said, because you don't know, because you don't really know like what are the expectations of like traveling alone, being in a new country. But then, to be honest, when you like overthink or like really anxious and nervous, you get really overwhelmed. And then that's when I thought to myself, like, there's no point in really like overthinking everything. Just go with the flow. And as I said, when I arrived at the airport, I was welcomed by the immigration officer, and I was like, this might be not too bad at all. And then life just go on. You meet new people. There was a Malaysian sister that approached me as well. Shout out again. There's so many shout out today, but to Hidayah as well, Kak Hidayah, for introducing me to Malaysian gathering, in which I met my friends that I have since my first year. And that's how I get to know more about, because my uni is a small campus, right? There's no Malaysian society. But I was lucky enough that, a sister approached me and introduced me into a Malaysian gathering, where I met all of these wonderful Malaysian people who are here, and they're also studying, even though they're studying in different universities. But then because we're in Glasgow, right, there's always a time for us to meet during the weekend if we make the time to. And from there, I know about Malaysian society in Glasgow University, in Clyde. And then after, in my second year, I just know about KMG. So that's how that's how like life will really guide you. So go for it,
Yeah. I think because no one actually likes changes. So, but if you take that leap of faith, then you can see that basically there's so much waiting for you, and you're gonna love it. And like what doctor said, just remember that you're not alone. Okay, wait. That's actually another question by Mariam. She's asking, if I want to register to see a dentist, does it have to be done through the GP? Anyone else?
I don't think so. I think you register with the GP directly. There is a GP yang, I'm not too sure, to be honest.
Wait, I think, can we get Fatin inside here? Because I think Fatin actually has done it. Abang Aiman? Fatin, can you actually tell us? Because I know that you actually done it. Sorry for calling you out.
Kalau untuk dental ni selalunya macam you kena call every klinik gigi dekat near your house. Ataupun if you tak sebab yang hari tu I call tu mostly kata diorang tak buka lagi new appointment sebab due to COVID kan, so macam appointment full. So kalau tak boleh you kena call the dental punya kena call dental punya service lah. And then
So
diorang akan,
that's not GP, is it?
Bukan.
Okay, so yeah, Dr. Mohammed didn't actually answer. Not through GP, dentist is a different entity. Okay, yeah.
Yeah.
So maybe like what
diorang
Fatin said.
nanti diorang akan macam guide you and bagi tahu which one yang available untuk you call for untuk registerkan yourself. Macam I register last October ke December, but sampai sekarang diorang tak panggil lagi.
Oh my god. Maybe sebab of COVID probably kan. There's a lot of backlog or something. Yeah. Okay, yeah. But to answer the question, so basically you need to Google up the dentist nearest to your place and then like call them up and ask if you can register with them.
Yeah. Tapi kalau sesiapa ada good experience, bolehlah share.
Thank you, Fatin.
Alright.
Okay, Jack says here, on behalf of KMGCC, we would like to invite Dr. Zainal and everyone who likes to cycle for cycling session next week. Oh, wow, okay, yeah, see. So if you come over to Glasgow, please get in contact with KMG because we do have KMGCC, which is the cycling club. So there's actually a lot of activities that we have here. So you're not going to be alone, you're going to have a lot of fun. Abang Saiful says, kudos to KMG for the great event, very useful talk. Thanks to speaker and all the moderators. Good job. Thank you, Abang Asih.
All right, I think it's already 9 p.m. and that was because we just interacted with the audience, but yeah, I want to ask moderators as well, like from Azalia, Amrin, or Fatin as well. How was the whole talk? Especially like for me, right? Like whether it's about new experience in Glasgow or about prostate cancer. What are your thoughts? Just like quick thought before we wrap up this whole session.
I'm kind of like a tech guy, and I really love seeing all this beautiful tech item. And when I see I did like having this. My mom is a nurse, and I used to spend like a day or two in the hospital sometimes. So I got to see this all different machines and stuff. And sometimes I just thought, why didn't they make something to put it inside and make it controllable from somewhere else? And then when I've joined this, and when doctor talked about that the robotic stuff, and I was like, oh, it is there. I was like, it's really amazing. Like that thing that I envisioned years back when I was a kid, like, oh, it's there. It's really nice to see what you would to see. Is there really nice to see that thing?
And there is such thing, yeah. I think like the best thing about sharing session, my brain's not working, it's already at night. Sharing session is like when you find out about things that you do not know. It's like putting new information, new knowledge out there for people. So this is actually a very fantastic event. Thank you so much, Doctor.
Yes, yeah, we would like to extend our greatest thanks to Doctor for the very wonderful talk from the very beginning about your experience and your advice coming to Glasgow, getting out of your comfort zone, and then advocate about prostate cancer, and especially it's a lot more common than you think it is. And yes, about you mentioned the normal symptoms that you always see in elder men. It shouldn't be normalized. It's actually it might be associated with diseases or prostate cancer, and that's about it. Doctor, would you like to just say last few words?
All right. So again, thank you very much for this opportunity. I'm very much appreciative of what you've been doing. And it's an honor to be the first speaker, and I think that this be continued on with other people as well. Sharing from whatever field, like sharing is caring, essentially, right? So you do a lot more whatever information that you can get, and it's helpful for people who are even already here or planning to come here. It's something that we should try and advocate so that people make the journey easier. So thank you very much, KMG, for this opportunity. Would really appreciate it, and looking forward to meet you guys face to face soon, hopefully, inshallah, when the opportunity comes.
Yes, hopefully, inshallah. Thank you so much, Doctor, and thank you for those who listen as well, tuning in, on a Saturday night. I hope that session was enjoyable and beneficial for you as well.
It's my son.
Hopefully you learn a lot.
Hi there. What's your name? I'm sorry, I'm getting distracted.
Oh, distracted.
Okay, we're just about to end the session. That was nice to see your side as well. Yeah, send our regards to your family and your
All right.
children as well.
Thank you.
Yes, and thank you so much, everyone. Hope you all have a very great night, and thank you so much. Bye bye.
Thank you.
Bye.